We've talked about what glucocorticoids are and how they are produced naturally in the body. And now we're going to talk about the ones that we're going to give to animals exogenously, or we're giving it to them from the outside. It's not coming from their own body. They are analogs. The ones that we're giving are synthetic. They're analogs of the natural hormones. They can be classified into glucocorticoids or mineral corticoids, as we've talked about before. They can be classified by their potency, their duration of action, and typically, if we want to make them soluble, then we're going to combine them with a salt. So we have different forms of glucocorticoids, typically for different purposes. So this is a chart of potency, and please don't memorize this, but it's just to give you an idea. It really goes along with the duration of action. So the drug appears more potent depending on the form that we're using. So at the very lower end, we have hydrocortisone and cortisone, and these terms are used somewhat interchangeably. In the previous talk, I mentioned cortisone as being part of the treatment with a topical triple antibiotic ointment for that hot spot. It would more likely be hydrocortisone. It gets converted to cortisone, so that gets used somewhat interchangeably. But these are typically in topical type of preparations. The next potent is prednisone and methylprednisolone, and then triamcinolone, and these are more oral or injectable drugs. And then dexamethasone and betamethasone, very high on the potency scale, and these are definitely injected. So that potency goes very closely with the length of action. So short-acting glucocorticoids are hydrocortisone and cortisone, lasting less than 12 hours. We have intermediate-acting glucocorticoids, and these are the PREDs. Triamcinolone is an exception in this group, but we've got prednisone, prednisolone, triamcinolone, and methylprednisolone. And it's prednisolone and prednisone are pretty close to each other. Prednisolone is the result of metabolism of the prednisone. Cats don't tend to convert the prednisone so well to prednisolone, so we typically give them prednisolone. That's just a little fun fact there. They last anywhere from 12 to 36 hours. And then the longer acting ones, lasting greater than 48 hours, so 2 days, are dexamethasone, betamethasone, flumethasone, and isoflupridone. And that one is known as Predef, and that one is used in cattle. So, how do we give these? So typically, we want to give the appropriate drug in the appropriate place. Not everything can go IV. Only the really soluble glucocorticoids can go IV. We don't tend to give them in the same way that we used to. IV glucocorticoids or steroids were given after trauma to help prevent inflammation in the nervous system, in particular after some traumatic event, and we don't tend to use it as much that way. It does stabilize membranes, so that was a really important characteristic that it was used for. So we don't tend to give these large doses IV as much anymore, but the use still exists. So these are, I've got the question, hydrophilic or lipophilic. If we're putting it into the vein, we want to have hydrophilic. And these just release for minutes after injection, so their length of duration is not very long. They're typically combined with succinate or phosphate. These are salts, and that makes them very soluble. Methylprednisolone sodium succinate or solumedrol is a very common one, used to be used for head trauma, spinal trauma, to help reduce inflammation in those areas after a traumatic event. So then we have moderately soluble glucocorticoids, and these are released for days to weeks. They exist in these suspended crystals, so they're suspensions. They need to be shaken before they're given. They are not given IV, they're given sub-Q or IM, depending on what the label says for them. They have these crystals, they need to be kept at room temperature. We don't typically refrigerate them or warm them up or anything, but it's really important that they're kept at that temperature. And so if you're working in an ambulatory practice where you're out in a truck all the time, these would be the things that you would put into a vet box, which would keep it at a constant temperature. So an example is methylprednisolone acetate, or Depomedrol is the trade name for that drug. And then lastly, we have ones that are poorly soluble. So poorly soluble are on the opposite end of the spectrum from hydrophilic. So these are the lipophilic ones. And these are released for weeks. And these are ones that you're going to administer sub-Q. They may have acetonide in them, and that makes them less hydrophilic, and they're going to stay in place for a while and be released very slowly. So it enhances their duration of action. So they can be released for weeks. We can give a kitty cat an injection of Vetalog, otherwise known as triamcinolone acetonide, and that is going to last that cat for a month, and it might help control an allergic reaction that they're having to something in their environment. And there are also topical preparations of these poorly soluble glucocorticoids. So in administering steroids, we think of 3 different dosage types, and we will do a problem where we'll look up a glucocorticoid that we're giving, and I will tell you to look for a particular type of dosage. And they're called supraphysiologic dosages. So first we start with the physiologic, the low type of dosage for glucocorticoids. We have animals that do not have a good functioning adrenal gland. So here's our kidney, here's our adrenal gland in cross section again. And an animal that does not have good release of these hormones is an Addison's disease animal. And I'm showing one line down because they do tend to have the symptoms of this disease, or they tend to be waxing and waning. One day they seem to be great, another day they're kind of crumped out like this dog is. And it can cause changes because it mainly affects the mineralocorticoid portion of the adrenal glands and the regulation of those electrolytes. We can get some really changed levels of those electrolytes, which can have life-threatening potential to them. So this is one that the treatment is to simply replace the natural level of glucocorticoids, and with a mineralocorticoid is what we're using. Sorry, not glucocorticoids, mineralocorticoids is what we're replacing. So we're just replacing that level to bring the animal to normal. They have too low of a naturally occurring hormone level, and so we need to increase that. So that's called a physiologic dose. It's just replacing what would normally be there. The next higher level is called the anti-inflammatory level, and this is the one that we're basically talking about in this chapter, is the amount that we need to reduce inflammation in the body. And so this might be given as for an allergy or something of that nature to an animal. Now, some animals have a condition where their immune system has been stimulated and simply does not go back down to normal. Inflammatory bowel disease is one of those kinds of things. Some extreme allergies and asthma, that kind of thing, are those types of conditions where we need to use what's called an immunosuppressive dose of steroids. And this immunosuppressive dose is very high, and we typically want to get that on board at a high level, get the immune system under control, and try to get the animal down to as low of a dose as we can to maintain that immunosuppressive effect that benefits the animal but does not suppress the adrenal gland too much so that it doesn't produce any of its own naturally occurring um, hormones. So those are the three different dosages that you will see in the formulary, and it's really important that the animal is being given the appropriate dose for the appropriate purpose.